Hazel Faith Delgado from Iloilo Doctors College, and for today's video, I will going to perform the physical examination of the integumentary system, the skin, hair, and the nails. Good day, ma'am. I'm Hazel Faith Delgado, and I'm your student nurse for today. So, ma'am, may I know your name?
Joyce Camilla,
Your birthday,
over 40,000.
and your age.
I'm 19 years old.
So today, ma'am, I will be assessing your skin, hair, and nails. So, do you experience any symptoms Wait, check the mobility and the repair of the skin. I'm going to assess if there is an edema in the feet. So upon palpating your feet, there is no presence of edema, as well as the skin has a mobility and the skin is quite thick. So next to assess is your hair, ma'am. Can I take off your Do you often color your hair, ma'am?
Mga 3 months old.
So upon checking your hair, there's no scars, as well as no lesion, and no parasites in the hair. And also the scalp is not oily. So next to assess is your nails, ma'am. So nails are groomed and has the clean toes and no loosened tissue. So next is to check the texture of the nails. So upon checking it, the nails come back immediately to clean tones after finishing it. So can you do this in your nails, ma'am? So the nails is 160-degree shape. So overall, ma'am, you have a good condition. So thank you for cooperating, ma'am. And if you have any problems, you can ask the physician that is assigned to you. And that's all, ma'am. Thank you. Good day everyone, I'm your student nurse Isel Faith Delgado, and for today's video, I'm going to perform the physical examination of the eyes. Good day ma'am, I'm Isel Faith Delgado, your student nurse for today. So ma'am, may I know your name,
Joyce Camilla Escalade.
your age,
I'm 19 years old.
your birthday?
October 14, 2000.
So today ma'am, I will be assessing your eyes. So may I know there are current symptoms you're experiencing, the changes in your vision? Have you ever trouble seeing at night? Do you experience eye pain?
After prolonged exposure to sunlight.
Redness or swelling of the eyes? Or the excessive watering of the eyes? So for the past history, do you have a previous or eye vision problem?
I have astigmatism.
you're wearing is the corrective glasses. So do you wear it regularly or?
Yes.
Now that you already established a report, so let's proceed to the assessment. So first thing to do is to do the hand hygiene. And provide privacy to the client as well as close the curtains. So and wear a gloves. Performing and expecting your external structure, ma'am. So I will observe your eyebrows, eyes, and your face symmetry. So may I take off your glasses, ma'am? Eyebrows are equally distributed and your eyelashes are outward. So next is to inspect your palpebral conjunction. So next is to check your bulbar conjunction. By inspecting both of your cerebral conjunctiva and bulbar conjunctiva, there's no sign of redness and there's no sign of cyanosis as well as jaundice and redness or swelling. So next is to check your lacrimal glands. So there is no swelling or edema that is present in your lacrimal gland. So next is to inspect your iris So, but your the left eye is quite easy, or do not interact immediately at the light. So, that's all, ma'am. Thank you for coming. And to the physician attending, please tell him more about what your symptoms or other experiences. Thank you. Good day everyone, I'm your student nurse Isel Delgado, and for today's video, I'm going to perform a physical examination of the ears. Good day sir, I am Isel Delgado, your assigned student nurse for the day. So sir, may I know your name?
I'm RJ Regayas.
Your age?
21 years old.
Your birthday?
August 2000.
So, I will ask your symptoms or what you currently feel. So, do you feel any pain in your ears?
No.
Any infection present?
No.
Are there any foreign objects that enter your ears?
No.
So, next is the past history. So, have you ever experienced any infection on your ears?
Yes.
What infection? Have any foreign objects entered your ears last time?
Yeah.
Have any foreign objects such as insects entered your ear?
None.
Have you ever experienced any illness or diseases related to your ears?
None.
So next is the family history. Do your family experience any ear problem?
None.
So how about in the health practices or lifestyle? How do you often clean your ears? Twice a day or 2 times a week?
Sorry, no lang. 3 times a week.
Now that we have identified the patient and established a rapport, we can now proceed to the physical examination. But before that, first thing to do is to prepare the equipment. Then, perform hand hygiene and donning of gloves to avoid cross-contamination and infections. Then, provide privacy to the client. So sir, can I touch your face for I will inspect your ears? So the colors of the ear is the same as the color of the skin. Then the ear is aligned to your eyes, sir, and it's perfectly normal. So next, sir, is that I will palpate your auricles and your ears. So the auricle is firm and not tender. So next is that I will inspect your ears and the So the ear canal is the same color as the auricle. Then there is no foreign bodies present, but there are cerumen or earwax, which is totally fine. Next, sir, is that I will do a whisper test, wherein I whisper a sentence, then you will repeat what I said.
I will do my red then today.
So the findings are all normal. Then if there are other symptoms that you might feel, you can tell the physician that I will refer to you. So thank you for your coordination, sir, and have a good day. Good day everyone, I'm your student nurse Isolfit Delgado from Iloilo Doctors College, and for today's video, I'm going to perform the physical examination of the heart. Good day sir, I am Isolfit Delgado, your science student nurse for today. So, sir, may I know your name?
I'm RJ Reyes,
Your age?
21 years old,
Your birthday?
August 2000.
So today, sir, I will going to perform a physical examination of the heart. So, sir, do you feel any pain in your chest?
None.
Do you feel shortness of breathing?
None.
Next is the past history. Do you experience any heart-related disease, sir?
None.
Or have you ever diagnosed in a certain heart disease?
None.
And next is family history. Do you in your family have experienced any heart-related disease?
None.
How about in practices in health lifestyle? Do you often exercise and eat fruits and vegetables?
Sometimes.
Now that you have identified the patient and established a rapport, you can now proceed to the physical examination. But before that, first thing to do is to prepare the equipment. Then, perform hand hygiene and donning of gloves to avoid cross-contamination and infections. Then, provide privacy to the client. vein in your artery. So, next one is that I will oscillate and palpitate your chest and your cardiac. So everything's normal, sir, and there are no murmurs to be found. Then, if there are any symptoms that you may feel, you can ask the doctor or the physician that are left with you. So thank you, sir, for the cooperation and have a nice day.